Assalamu alaikum, Honorable Chairperson, learned faculties and audience. I'm Dr. Minhaj Bhuiyan, going to present on the topics oncoplastic surgery for breast cancer, median 3-year follow-up results. Actually, this work has been performed in 2021 to 21, 22, 21, 1 and 2. Now, enable them, again enable them. ব্লক হয়ে গেল escape them. So, sorry for inconvenience. So, oncoplastic surgery of the breast cancer. Oncoplastic surgery is an integrations of scientific principles of oncologic surgery with aesthetic techniques of plastic surgery to give better outcome to breast cancer patients. There are three goals of oncoplastic surgery: better cosmetic outcome, avoided mastectomy, and overall satisfaction and quality of life. There are multiple issues for oncoplastic surgery: margin, local recurrence, oncological outcome, delayed adjuvant therapy, as well as missing recurrence. Interestingly, for margin clearance, we are very in safe side. 15 to 20% margin clearance. This is quite higher than that of the conventional BCS. In local recurrence, although there are some more increased rate of local recurrence in case of oncoplastic surgery than that of the BCS, but this is not statistically significant. But in terms of 10-year survival and regional distance metastasis, both in these aspects, OPBS is ahead than that of the BCS. There are multiple levels: level 1, level 2, level 3, and level 4 oncoplastic surgery. In classification, we can classify it broadly in two ways: volume displacement and volume replacement. So for reconstruction purpose, after getting BCS or plastics, partial mastectomy, we can go for volume replacement or volume displacement as well as symmetrization of the opposite breast. So there are various techniques of oncoplastic surgery, and this is our glimpse of some surgery. First, I will show some works that has been done in our cancer institution. For upper quadrant, we go for Batwing or hemi-Batwing mastectomy. And this is 9 months downline after getting the radiotherapy of the same surgery. We can go for parallelogram. This is after 10 post-operative day, and this is the result after one year. For outer quadrant, we go for lateral mammoplasty. For inner quadrant, racket mammoplasty we do. For upper inner quadrant, matrix rotation perform. This is after 3 months. Beamoplasty. These all are the examples of our works. For periural tumors, we go for round block techniques. Crescent mammoplasty. And this is the result after 12 months. Lower quadrant, we do inverted T mammoplasty. After 3 months down the line, after 7 months, after 24 months follow-up. For lower outer quadrant, gemmoplasty. center quadrant Grisoti techniques or keyholes dermoglandular flap. For outer quadrant LICAP. So this is the techniques starting from round block to keyhole dermoglandular flaps we adopt in these works. So in this study we took 58 patients starting from September 2021 to February 2022. We adopt 14 techniques and our follow-up range time is 30 to 38 months and medium follow-up time is 3 years, 36 months. And our endpoint was cosmesis, primary endpoint was cosmesis, recurrence, disease-free survival and overall survival. A secondary endpoint was quality of life. For outcome variables, cosmesis we go for 4-point Likert scale, ipsilateral shape, cleavage, scar visibility and symmetry. For recurrence, we look for local, regional and distance recurrence. And quality of life, body shape image, fear of recurrence, patient satisfaction with treatment and cosmetic result. So let us see one by one of our results. Cosmesis, you see that for ipsilateral shape, excellent and good result in most of the cases. So in this category, good and excellent result is 52%, that 52 patients, that is 90% achieve good and excellent result in terms of cosmesis. For recurrence, we have 2 patients for local recurrence and 1 patient in regional recurrence and locodistance, that is local and distant metastasis was found in 2 patients. This is the technique I've already seen. For keyhole patients, the patient come to us, the patient was regularly in follow-up, and after 21 months, we get regional recurrence in axilla. And the patient, in primarily, we go for sentinel lymph node biopsy, but we don't go for axillary dissection. But after 21 months, having all sort of treatment, chemotherapy, radiotherapy, the patient come with a recurrence in the axilla, and that is why patient was by axillary dissection. And this is one of the example of local distance recurrence. The patient come to us after 17 months of this surgery, after getting chemotherapy and radiotherapy. And patient is on hormone therapy, but the patient unfortunately developed local as well as vertebral recurrence. And we lost the patients. And this is another example, interesting example. The patient underwent inverted T myoplasty. After 29 months, she was regularly followed to us. The patient presented the ulcerated lesions in the nipple. We took a biopsy and this come Paget disease of the nipple, and we excised the nipple, only nipples. And this is another example of local recurrence. After 35 months, the patient developed recurrence not in the operative site, rather away from the operative site of the same breast. And our local recurrence rate is 8.6%. In terms of quality of life, the patient highly satisfied and satisfied was 76% to 22.2%. Fear of recurrence, you see that majority patients are about of fear of recurrence. And in terms of patient satisfaction, we find that 84% patient was highly satisfied with the procedures. For cosmetic result, highly satisfied for 80% patients. For disease-free survival, you see, in terms of 3 years disease-free survival, we got 91.6% patient has disease-free survival rate. And if we consider the overall survival, here is also 96.6% patients was 3 year survival rate. Only 2 patients we lost. One for local distance recurrence, and both are local distance. And all of the patients, there is 56 patients are alive. So in conclusion, we can say oncoprocessor is safe and feasible for Bangladeshi breast cancer patients, and it should be the standard of care in breast cancer surgery when appropriate. It is still under practice though it offered better cosmesis without compromising oncological safety. Basic oncoplasty to advanced oncoplasty to extreme oncoplasty is the learning curve. Now I giving into invitations, and that is the Breast BDCon 2025, and it will be organized in the fair will be in the next year, February 2023 to 24, on the Bangomata Sheikh Fazilatun Nasa Convention Hall, Dhaka, BSMU, Dhaka. I am Professor, on behalf of Professor Mizanur Rahman, I am requesting and inviting all of you to participate in this conference on breast cancer. Here, expert faculties on breast surgery, imaging, on oncology from UK, Turkey, and India will be available. I hope this will be very enjoyable and learning sessions. And this conference, I will rather request to registration in this session. So with all this, I want to give thanks to all. Thank you for listening.